And next in the studio, we have Dr. Ezra Nayelugochima, who is the President Association of Resident Doctors, ESUT. And we're going to be talking about the abuse of health workers. Good morning and welcome to the studio.
Good morning.
Okay,
Good
so
morning.
first of all, let's look at the abuse that health workers face day-to-day activities.
Okay, thank you very much. There is a research that shows that health workers are 5 times more likely to be abused at their workplace than every other sector. And this abuse occurs mainly at the emergency point. That's the softest point where this occurs. And it has become so common now in Enugu State that within the space of December and January, in Parkland, for instance, we've had over 5 attempts, although only one degenerated into physical abuse. Then there is also another case that was reported at National Orthopedic Hospital in Enugu here, okay, and then across other tertiary hospitals in Enugu here. So health workers, yes, there are different forms of abuse, okay. There are physical abuse, emotional abuse, psychological abuse, okay, but the one that actually triggers the association most, okay, because we are resident doctors, and then we'll have an association called Association of Resident Doctors, and then we're under the umbrella of the Nigerian Association of Resident Doctors. So the one that triggers the Nigerian Association of Resident Doctor most is the physical abuse. That is the one that is not taken lightly. So, and just about a week ago, we had an incident, okay, of this, and it actually affected 4 doctors. Okay, not only were they physically abused, they were also verbally abused and emotionally abused, and right now they are even scared that they don't even know if they should leave their houses again with their cars or not, because the people that lay the abuse actually threaten that we know your plate numbers, we know where you will live, we'll come for you. Okay, and it's not been, like I said, like in December there was also something similar. That one didn't degenerate into physical assault because we intervened early enough. Okay. However, I think this discussion is just for us to talk to our viewers and the people of Enugu State that there are channels through which you can lay your grievances, okay, if you are grieved, but resulting to an assault, especially physical assault, on healthcare workers is not something that should be heard of, especially when we are battling an emergency brain drain. In fact, Nigeria is battling brain drain of healthcare workers. Let me not just talk about doctors alone. Okay, so the least we can do is how do we encourage even the ones around to stay back and assist. Almost every healthcare worker has an opportunity to live in the country. The ones that stayed back, it's not because they don't have the opportunity to live, it's because they want to go extra mile to be patriotic. But then when you keep putting them through harm's way like this, they don't have any other option than to go to a place where they feel secured. Okay, so it wouldn't be nice if you come to a place just like last year. Remember when there was an interview last year? Okay, there was an advert for health workers to come in. Now, a particular department needed about 10 people to fill up the space so that the place can run, and only about 5 people applied. Okay, so it means that others have already left, or there are no people available to even fill up the spaces. And then if you keep hearing this recurrent cases of assault on healthcare workers, especially doctors, then there will be a time you call for interview and nobody will show up. Okay, so I believe this discussion is just for us to talk to people of Enugu State and then to sensitize them. There are ways by which you can channel your grievances and it will be sorted out without resorting to.
Is there any form of punishment for people that, for patients that go out threatening health workers?
Okay, yeah, ideally there should be a form of punishment, okay, but to the best of my knowledge, there is no outlined punishment, okay. However, the hospital management and institutions to Parkland are trying to come up with a protocol, okay, like a punishment protocol that if so and so is done, then these are the things that will happen. Okay, however, at the moment, what we usually do is that as soon as it results into physical assault, we involve the police. Okay, but then there should be more should be done. There should be a legislative support okay, on this from the law making agencies. Okay, there should be policies, okay, from from both the hospital and then the policy makers of on healthcare, and then there should also be a form of media advocacy, which you're already doing now, okay, and then sensitization to people. I understand that yes, things are quite hard, people are going through a lot, but then you don't need to let it out on your fellow human being. Talk more of healthcare workers.
Okay, so where does this abuse come from? Is it patients to doctor, patients to healthcare workers, or the authorities of the hospital to the doctor, or the authorities of the hospital to the healthcare workers? Where does the abuse majorly come from?
Okay, majorly the abuse come from patients and patient relatives to healthcare workers, including doctors, nurses, and every other person working within the hospital sector, within the health sector. Okay, that is where it comes from majorly. Majorly, yeah, that's where it comes from.
Okay, but there has been issues of doctors, healthcare workers with the hospital authorities, right?
Yes, that has also occurred, but it is not as common as the other one.
The other one.
Yes.
Okay, so what triggers it really? I mean, when you say relatives and patients of relatives come against healthcare workers, what exactly triggers it?
Okay, like the statistics I quoted earlier. Okay, I said that five physical assault at healthcare in a healthcare facility, okay, occurs 5 times more than any other sector, and it occurs more in an emergency situation. So now, because they present or they come in as an emergency, now they expect you to come in immediately to attend to them. Okay, so when they see that you're not doing that, then they tend to get agitated. So most times what triggers that is when they want you to go out of your way to do what they think you should do, which I do not know where they actually get that knowledge from. But then when there is an emergency, there is something called triage. Okay, now triage is the doctor and the team, they all assess this. We have 5 emergencies, we are just 2 of us on duty. Out of these 5 emergencies, which one is more emergency than the other? Which one are we not going to waste our time on, because this is likely going to result to death? Okay, so they triage and then start based on that. Now, some of these people, their relative come in with the assumption that there is a reason why they are abandoning our own person and then attending to others. So because of lack of knowledge, principally, I think it's just lack of knowledge and understanding, okay, then they resort into abuse. Sometimes it could also be finances, okay, because you may come in, okay, like just like in a government hospital, okay, you may come in, you don't expect a doctor to bring out his own things. There are basic things you need to do with your money, and then you may ask them to go doing that, and they are not able to do that at a particular point, and the next thing you see is that they want to start destroying everything and start telling you that this is a government hospital, they're supposed to care for everybody. But then the policy on ground is not giving room for some waivers in some areas. Okay, so, and another thing that may also be able to help this is if there is a wide coverage of insurance for everybody. So once you come in with your insurance number, so long as it's active, then everything will be, there will be mobilization to get everything for you as it should be. Okay, but then we don't have that yet. We are even still far away. How many people are covered with insurance? So, but basically, I would just say that the main trigger is ignorance, and because it occurs mainly at the emergency point, or at the point of emergency, and because of the lack of understanding, then they resort into abuse, hoping that it is going to change things for them. But most times it doesn't. Rather, it will actually spoil things, because you abuse a doctor, the doctor have to run for his safety. You abuse a nurse, the nurse have to run for his or her safety. So, and before you know what's happening, they may not even show up again until they are sure that they are safe.
You mentioned something about last week or last 2 weeks that something happened that 4 doctors are scared to even come to the hospital. What was that particular matter?
Okay, well, they were assaulted, physically assaulted by patient relatives, and they were beaten up. Some of them were
at the hospital.
Yes, at the hospital.
Wow.
Okay, so some of them, a good number of them left with injuries. And they disappeared. So eventually, the Nigerian police intervened. Okay, with other security agencies, they intervened. The hospital management is actually on that right now, Okay, and that is even one of the reasons why I would say it is good for us to start the media advocacy. Let's talk to our people. There are ways of channeling your grievances. If you are aggrieved, the doctor is under somebody, and the management is, which is the hospital management. The management, if you think the management hasn't done well, they are also under a ministry, which is the health ministry. If you think that the ministry hasn't done well, the ministry, every ministry or every commissioner is under the governor. So you can approach it that, way, and then get your clarity or justification to whatever grievances you think may have made you to result into physical assault or any form of assault.
Interesting.
Wow.
Okay. I've seen situations where people come to the hospital and the nurses are reluctant to attend to the person. Situations where you just come in and you want to get the attention of a nurse, and the person is not responding, not even looking your way. Why does it always happen that way? Because this is what breeds abuse of health workers.
Okay, well, I'm a doctor, but I'm going to give you an insight. Now, there is this general belief, okay, amongst our people that healthcare workers are pompous, that nurses are arrogant, okay? So now when you have that pre-informed notion, you come in and then you're talking to someone, maybe the person's mind is not there, or the person it has some worry, okay? So you begin to act based on what you are already told. Now, why I won't go defending. There are actually some healthcare workers who who may not be professional, okay, at some point. Now, but what we are saying is that yes, Nurse A, Dr. B, has not been professional in what he's doing, but then two wrongs cannot make it right. Okay, so how do you now call that person to order? You follow the proper channel. You don't go into physical assault. Okay, so if you feel that maybe a nurse assigned to a particular ward has not been giving you the attention she's supposed to give you, okay, then you channel the complaint appropriately. And if she's found guilty, or if she's found guilty, culpable, then she'll be punished as well. There's also a way of punishing professionals who are also not doing their duty as it should be. Okay. However, people should also understand that there are some questions you ask a nurse that she doesn't have an answer to, and she will refer you to a doctor who should actually give you who it is his right and within his own prejudice to give you supply answer to that question. So when a nurse is not answering such question, it doesn't mean that she's being arrogant, okay? But like I said, I'm a doctor. I won't be able to give full detail about them, but based on my experience in a hospital setting, okay, I've seen people resort to abusing nurses because they felt maybe a nurse would have done this, okay, or a nurse would have actually told me this, but it may not be within her own within her jurisdiction to tell you such, to give you such information. Okay, she may probably be referring to a doctor, but you don't want her to do that. You want her to tell you, to supply the answer, because our people are not patient. We're not easily patient.
I don't know why people in this part of the world prefer private hospital over public hospitals. I mean, it's a hospital. Sometimes they even say the same doctors that you see at the government hospitals are the same doctors basically that you see in the private hospital, because these guys at the public hospital, go to build their own and then make it sophisticated and or whatnot. Do you feel that there is a debt of doctors? In fact, doctors pay attention more to their own business, to their own hospitals, to their own clinics than they would pay to a government hospital, and that's the reason why you have some of these things happen in such a way that you don't even find a solution to the problem.
Okay, let me approach this question this way. Okay, there are different cadres of hospital. You have a primary, tertiary. So you have primary, you have secondary, you have tertiary. Now, there are also some private hospitals that operate at the primary level. There are some that operate at the general hospital level, while there are some that operate at the tertiary level. Now, when it comes to Nigeria and in Enugu State, for instance, okay, the government hospitals, especially the teaching hospitals, they are like the highest. That's the highest level. Okay, so no matter how you go to a private hospital, once it gets to one there's a level to get to, they will refer you as well to a government hospital. Now, when you come to a government hospital, okay, you don't expect to have the same kind of treatment, that kind of VIP treatment that you had in a private hospital. Now, the reason why it is like that in the private hospital is that it is someone's business. Maybe they have one or two administrators who want to ensure that this can happen this way. Okay, so now when you come to a government hospital, for instance, like maybe like Parkland, for instance, now you've come in as a patient, you'll be given a ward like every other person, and they will not assign one nurse to you. Okay, you're going to have the same group of nurses on duty are going to see you and every other patient. Now, if you come in into a government hospital with that notion, or maybe expected to be treated the same way you were treated in a private hospital, then it's going to cause issues because there are peculiarities. Now, those private hospitals can decide and say, once we have 5 patients in the ward, we're not admitting again because we have only 5 nurses. But you cannot come to a teaching hospital, and especially when that is the only teaching hospital, okay, within the Enugu metropolis, and then tell patients who are coming in, no, we cannot take you in. Okay, so now there are no I wouldn't want to say that there are no preferential treatment, or maybe there is a deliberate action to run down the government hospital so that people come to private. No, but because the people in private run it as a business, okay, they try to make sure that they maintain a certain standard, and because that certain standard is maintained, there is a level to get to, they will refer you immediately. Okay, and then when they refer you, you still come to that same government hospital. Okay, and they'll still come there if actually they work there as well. They'll still come there and see you, but it will not be the same level of packaging that they have there that you also get here. Okay, so it's just because there is that of doctors or healthcare workers in Nigeria. So the number of healthcare workers we have in Nigeria we have about, okay, last year they said about 58,000 doctors renewed their license out of 130,000. Now imagine 58,000 doctors taking care of 200 million plus. It is a dire emergency. It's not going to work. So that satisfaction you are craving for, you most times or most likely not going to get it in a teaching hospital setting. Okay, but it is not a deliberate action. It's not a deliberate act.
Okay.
Yeah, but it's the same doctors that you usually see in the public and that you see in private, and they are not as quick as they are but you've explained it that way. But I mean, somebody can decide that, you know what, I'm going to give attention to my business over working for government. After all, government property, nobody gets government work. I mean, we see that play out every now and then, isn't it?
Well. I still want to approach it from a different angle. Okay, now when you're on duty, you're on duty, even if it's in a government hospital, and there are checks and balances. Okay, so when you're on duty and you're called, you're bound to answer. So if the doctor hasn't answered, there are also ways of knowing that he hasn't answered if he's on duty. So now it doesn't mean that the doctor will leave his duty in a government hospital to a private hospital, assuming that the person combines the two of them. Okay, so you do in such a way that it will be flexible. Even in UK, we have you have doctors who work in NHS, then during their own free period they go for locum in private settings. So that is the picture here. But it's not as if they give preference to the private or not. Okay, now I give you an example. You may take an emergency to a private hospital, for instance. Okay, and then they ask you make a deposit of 1 million. Okay, let me use Memphis for instance. You go there, they ask you to make a deposit of 1 million. As soon as you make a deposit of 1 million, they take the patient in. They know where to go and bring something from. Now, if you have a similar emergency and maybe you come to Parkland or maybe you come to UNTH for instance, as soon as you bring the patient into the emergency, you go and get a card, you go and pay for a card. The doctor assesses, write out some investigation and drugs, give the patient relative, you go to a pay point and pay. Go to a place where you're going to pay
before
drugs.
You even touch the patient.
You need to get all those things. No, they are going to use the ones in the emergency tray first, but you're going to get those things to replace. Okay, now these are two different ways. If you don't do it like that, then there'll be no accountability. Okay, and that is where the insurance thing comes in. If there is a wide coverage insurance, you can be sure that you are getting these things, and then the payment has already been made prior to that time, so you can easily fund the hospital. Okay, but in a private setting, once you make the initial deposit, which they ask you to make, they go to their own pharmacy to source those things. They don't give you again except what they don't have. Okay, and that is why it's easier to run a private health setting, because you can say, I can only take 5 patients today, and once they get to that 5 patients, the rest should go elsewhere. But like I said, you can't come to a teaching hospital, for instance, like Barclay, and then expect to tell patient to turn patient back. You can't do that. Okay, so sometimes our doctors even stay in clinic up to 7 p.m. Okay, just because they have to see all the patient that came, even when there are very few. Okay, so because they can't turn patient back, and these are the things that cause agitation. Now, if you start doing that, who is not going to take care of? Who's not going to bump up those ones you're going to turn back?
All right, let's leave it here. Well, before we go, let's say yes or no question. Is there a rule stating clearly that doctors should not treat gunshot wounds?
There is no rule stating that.
So if somebody is brought in and you are shot by somebody, you can go ahead and treat the person.
You start treating the person. Why treating the person? You inform depending on the hospital, you inform the the management. The management will inform the legal practitioner or the hospital's lawyer, okay, who will now take it up to make a complaint that will have a gunshot injury. We are treating the patient. These are the details. Police will not swing into investigation, but you don't reject the patient. It's an emergency, so you take care of the emergency. Why that is ongoing.
Okay, let's leave it there. Thank you so much. We truly appreciate your insight today.
Signature TV. News in your pocket.